the life of a patient who's struggling with obesity is a poor life. I mean, their quality of life is very poor. Their self-esteem is low. They find discrimination at workplace. Even the medications that they are on don't work. And they go to a physician's office from one to another, and everybody wants them to lose the weight, but no one has a solution for them. So they're living, but they're not really living.
Many people who come to us for surgery have really struggled with their weight for a long time, and it's kept them from being healthy, but it's also been a barrier to lots of different things. Certain activities, I've had people tell me that they really want to go to an amusement park, but they can't fit in the rides that they want to go on. Or it's been a barrier to them moving ahead in life because they're so conscious of their weight. So it can really help a lot with medical problems, but it also just empowers people to do things they might not have felt capable of when their weight is not under good control.
So they have this sort of the inner self that is sort of struggling and with no hope. They come to us without any hope of really long-term success of any weight loss. Or they want to see their children graduate. They want to see their children marry. They want to see their grandchildren, and they want to play with them. And that's what we associate living with. So when they come to us, that's what they want to do. They want to live a full life. So what bariatric surgery does, we like to call it bariatric and metabolic surgery, because it changes the metabolic conditions that are keeping them down. The diabetes, the arthritis, the depression. So all of that really remarkably improves. And we see that every day. And that's what the remarkable thing about this thing. And in order to get them to be successful long-term in life, since this is a chronic disease, obesity is not a one-time thing, it's a chronic disease. You need to prepare these patients pre-operatively. We need to give them the tools to be successful post-operatively. It's a marathon, it's not a 100-meter sprint. So in order to do that, we need to give them the education about nutrition. We need to help them have the behavioral tools that they need so that they're not eating when they're down. They're not eating when they're stressed out. We do that. All of us do have some stress eating or emotional eating. So all of that needs to be worked on. It's just because I did an operation, the long-term consequence of eating is not going to change. We need to make sure our patients have the tools. And that's how we differ from a lot of the programs. We have all of that in one place.
Come talk to us. Come hear about it. Come hear about it from us. Come hear about it from the patients. Talk to your doctor. Talk to your friends and family. And hear more about it. Help us help you make that decision.
The nice thing about the seminars is we basically kind of cover bariatric surgery from the 10,000-foot view, basically. You learn a little bit about all the different operations, risk, the benefits, why we do one versus the other, why we would recommend one versus the other, a little bit about how they're actually done, and then a little bit about what the results are in terms of weight loss, in terms of complications, in terms of long-term success. So after the seminar, patients have a pretty good flavor for what the different options are that are out there and whether or not one versus another is one that they'd want to go down the road.
The first operation that people have heard about is the gastric bypass. The second operation is a gastric sleeve, a sleeve gastrectomy. And the third operation is the band. All these operations, about 99% of them, are done laparoscopically. That means we are using small incisions, like button-sized incisions, 3 or 4 or 5 of them, to get inside the abdominal cavity and do this operation using the most modern technology that's out there. And so all the surgeons at USA that participate in the bariatric program have not only had their surgical training, but have the additional training in bariatric surgery and minimally invasive surgery, so that we have the best experts to do this. It takes a lot of discussion. We work with the families. It's a very long process. We want to make sure that we pick our patients well and they have the support after surgery. So it could be from anywhere from age 16 to 70. We don't really have a upper cutoff, but someone who actually wants to change their life around. So the person who wants to have surgery has really committed to change. That's the most important thing.
I think that we work all very well together, and we're very willing to help one another out. One person can't do everything, and I can always rely on my partners to be there to see a patient if I can't make it, and I of course do the same thing for them. We're just a tight-knit group that works well together.
Within Rhode Island, our group has been doing bariatric surgery since the late 70s. The current senior surgeons have enough experience that we've dealt with pretty much everything that you can see in bariatric surgery.
We are lucky at University of Surgical Associates to be able to work collaboratively with our partners at Miriam Hospital, who we can have a one-stop shop when it comes to weight loss. So our typical patient would be able to get all this help from all different specialists who are helping them in one center. We don't have to send you away to a different town or different hospital that you get lost in the shuffle. And that is often the case when it comes to healthcare these days. They get shuffled around and no one knows what the other person wants.
So most people just spend about 2 days in the hospital, some people only 1. And even by the time they're discharged, a lot of people are off of some of their medications that they've come in on. At that point, they haven't had significant weight loss, but just because of some of the hormonal changes that are going on, they might be off of their diabetes medications. They may be on a smaller dose of their antihypertensive. So big changes can already happen very quickly after surgery.
After any of our procedures, the expectation is that we're going to see patients frequently for the first year, and then less frequently over the next 4 years after that. So we expect to see people for 5 years post-procedure.
An operation is not a magic bullet. It's not a one-time event. Surgery is a one event in a series of events that they're going to do that they're going to make them successful. So our patients are motivated to change their life. They're motivated to get better. They're motivated to change their habits and learn more about nutrition. Okay, so we invest the time upfront and also after surgery.
I think a lot of people think they're going to be eating mush for the rest of their lives, which is not the case. Many people are so discouraged from previous attempts at losing weight. They say, well, how do I know this is going to work for me? Sometimes people are really concerned about who to tell that they're having surgery, or should they tell anyone, and how to, get through that discussion with friends and family, especially when some are not supportive. How to try to align their friends and family with what they've decided to do.
When you say bariatric surgery, the first thing the emotion that comes out of people's heart is that it's dangerous. People die. But the opposite is the truth. If you look at many studies, especially given the improvement in technology and the quality of the surgery, the chance of dying from weight loss surgeries less than dying from a gallbladder surgery. So that's how we have come a long way in improving the quality of care, especially when you come to a program like at University of Surgical Associates, and surgeons are trained and they're there for you 24/7. Insurance companies have come a long way in recognizing the benefits of bariatric surgery. About 10-15 years ago, the fight to get a surgery approved was incredible. What has happened is insurance companies have figured out that when the patient actually seeks bariatric surgery in the long term, they actually save money. Okay, so they're actually now encouraging people to consider it, and it's available. And we live in Northeast and New England, where most insurance companies are proactive about this, and so we are able to offer for a variety of insurance, whether it's commercial, United Healthcare, to Blue Cross to Medicare and Medicaid. But everybody has their own rules, so we have to make sure, based on the patient's insurance company's rules, we had to abide by that. And those are different. So that's, sometimes it gets a little bit tricky about what their requirements are, but we comply with those requirements, and the companies actually are supportive of bariatric surgery.
Seeing people succeed, I mean, it's amazing when people come back and tell you about things that they have maybe never been able to do before, and now they can do them. And you know, they're just so proud of themselves, and it's really great to be able to help people help themselves.
It's really when people do reach those weight loss goals. It's to see their excitement is really satisfying.
The most rewarding part of being a bariatric surgeon is that you use the most modern technology that's out there in surgery to do a complex operation and then follow these patients for their lifetime and change their life completely. I mean, sometimes that's what you want to do as a medical student, but you never get that opportunity. But I'm doing that now. That's what I love about this job.